Today we have Dr. Joshua Jones on. This is the Working on Wellness Radio Forum. Dr. Jones is the director of Providence St. Joseph Health System. He's a forensic psychiatrist, and he's talking about AI today. And if you're just joining us, Dr. Jones, is AI safe to use for health information?
Fabulous question. And of course, the answer is nuanced. I would say generally as a lookup tool, it is probably as good as Googling things. But what I would really caution people on doing is using it to make any medical decisions. You take that information and then talk with your trusted healthcare professional before you make any medical decisions based on what AI or what Google says or what you read in a book, for that matter. This is information. This is not a doctor. It's not trained like a doctor. And in fact, if you actually read the terms and conditions, and with AI you should. I know we all skip past the terms and conditions, but you really should read thoroughly with this brand new, relatively new technology. You should read the terms and conditions about what the companies that are giving you access to these tools are using that information for. So to your question, is it safe to use for medical information? It is safe to use it to gather medical information, but just like anything you might read anywhere, talk with your trusted healthcare provider before you make any medical decisions based on what you read, what you hear from AI.
Do you have a favorite AI tool?
All of it really depends on what I'm using it for. And this is based off my experimentation with these AI tools. If I'm looking for some pretty technical information, then I will use Claude. If I'm looking for some specific medical information, then I will use a tool called Open Evidence, which is trained on a specific set of literary works. It's trained on specific medical journals to answer medical questions and is designed for medical healthcare professionals. So again, to really truly use these tools, how they're intended and for what they're best for, educating yourself about what the different uses or use cases is the fancier technical term, is really important before just sitting down and typing in any old medical question to ChatGPT and then carrying off with that information.
When you were here last year, you were talking about using Zoom more than you had in the past. And because there just aren't enough psychiatrists to go around. And you talked about how you like to meet your patient first. And if they feel comfortable using Zoom, then that is how you kind of continued their care. How does that work with AI? Are people coming to you after they've gone to AI and said, I think this is what's going on with me? Or I know people are referred to you by other physicians. So how does that work?
Yeah, great question. And the answer is really all of the above. People will have an idea that they might have a problem, and then they'll come to a psychiatrist, or a psychologist, licensed clinical social worker, anybody in the mental health care profession. Sometimes after they have put their symptoms into Google or ChatGPT and then say, hey, this is what it says I have. It's best when they come with an open mind and not that, oh, ChatGPT diagnosed me with this. No, it didn't really. Mm-hmm. It told you what you wanted to hear, and then they will come and bring that. Another way that a lot of doctors are using AI is that they will actually have a device like their smartphone that will sit there in the room with them and the patient, and then an AI program will listen to what they're saying and then will create the doctor's note for them in the computer. I hope most physicians are starting to use this tool because it can save them a lot of time, and it can really
summarize.
It can summarize, mm-hmm. and it can really allow them to have more time with the patient. But, and you know what the but's going to be, Olive, both parties, both the patient and doctor, need to understand the limitations of that tool. Is it HIPAA protected? Is it going to be confidential? Is it keeping a recording somewhere? All those are questions that have to be answered before you use this or any other healthcare tool.
So you don't see AI being your therapist someday?
I'll never say never, but I think as we currently understand AI, that would be incredibly dangerous. AI, as we talked about, doesn't feel. It cannot connect to the way that you and I are connecting, right? Only about 10% of the communication that you and I are sharing as we look at each other, Olive, is in words. The rest of it's in body language. It is in the way our facial expressions reflect off of each other. That's really important, and AI can't do that. And that is part of the therapeutic experience. So we also know that some people have tried to use these large language models as their therapists to sometimes disastrous consequences. There are active lawsuits out there about people who thought or believed that these these AI tools were their therapist, and they ended up in great harm and sometimes even dying. So no, they're not for that now. I don't think they're going to be that for the future. If they are, they better and should be specifically designed to have what a therapist brings in their programming, which is empathy, which is an ability to detect when something is really, really dangerous. For instance, when somebody is really, truly giving off indications of suicide, I, as a psychiatrist, reach out for help. These AI tools don't.
And so if someone is getting too connected to a program that they've, like my AI boyfriend, that's a sign that this has gone a little bit wrong.
That's a big red flag, yes. And you'll read lots of pop culture and pop sci articles about these kinds of things. From a psychiatric perspective, those are big red flags. Those are people who are really thirsting for human connection, aren't getting it, can't find it for whatever reason, are turning to this computer, and it's really not what it's designed for. I think you and I are going to talk about what these are what these are actually designed for. Probably right now.
Yeah, what are they designed for? Well, I tell you, I guess if someone was very, very lonely and depressed and they couldn't reach out any other way, and this is one way that they did it, if like a loved one was falling down this rabbit hole, how could you help them? Say, gee, I think this is a bad idea.
Yeah, great, Olive. And the number one thing you can do is exactly what you said. Reach out and say, how can I help you? The human connection is what people are thirsting for, are longing for, often in these situations. Reach out, help them, surround them with other loved ones, find out what's going on. If needed, see if they'll see a healthcare professional. Those are all things you can do if somebody is, falling down this rabbit hole of being too immersed with their AI program. When we talk about these things, it's my AI bot and everything, and those are all linguistic tricks we use to project our feelings onto this tool. This is just a computer program,
right,
that is housed in some server somewhere.
Well, AI companies are making millions on this, but if you're not paying for AI, where's the money coming from?
Yeah, the great question, Olive. First of all, mostly it's a speculative business right now. So they have a lot of investment from venture capitalists, from these large AI companies, because they think this will pay off down the road. It's starting to, because they are starting to be able to sell specialized parts of these AI tools to things like healthcare companies, computer manufacturers. AI is doing most of the computer coding now and not humans. So they're starting to make money that way. But right now they're in the speculation and investment phase. And they're really making their money in the future by harvesting information from us right now. Because when you're using your ChatGPT or Gemini for free, they're taking that information, you're giving it willingly, chopping it up, slicing it up, packaging up, and then using it to train the AI tools down the road. So our information becomes their product. My brother, who I do our Sentimental podcast
We're going to talk about your podcast.
But my brother has this great phrase. He says, if something's free, you are the product.
Mm-hmm.
So right now we are the product. You're being allowed to use this, Chat GPT for free because it's worth it to the company to have you have free access to it, so they can get your data on how you're using it, what questions you're asking it, how you're responding to it, so they can make a better product in the future.
Is AI affecting how we think?
Yes, it is. It absolutely is. We know this from some early scientific studies that are suggesting that heavy AI use may cut down on creativity, it may cut down on logical reasoning, and it may cut down on the speed with which people solve problems. Anecdotally, hearing from college professors, high school teachers, even college and high school students themselves, it's absolutely degrading how well students at those levels can write, can reason, and can read, even. Because they don't need to read something. They can have AI. They can have AI read it and summarize it for them. They can have AI take their entire class for them if they want.
You remember Cliff Notes?
Yeah, those are that just dated you, Olive. I will tell you that. Yeah. But yes, so yes, it is absolutely changing the way we think. Now, are there ways in which it's changing the way we think for the better? Probably. And what I advise people, and what I am trying to do, is to use AI to figure out what it can do for you without letting it consume all the ways that you write and you think. Because I think the people who are going to come out ahead with AI usage are going to be those people who can maintain creativity and reasoning while also figuring out how to use AI to make them faster and more efficient.
I can certainly see that for summarizing and getting information that, you're having a conversation with your patient. It's recording it and summarizing it for you, but you'd still have to go back and read it and make sure that it caught everything that you wanted it to record.
That's exactly right.
Yeah.
I think what I use AI for in my clinical practice most is to summarize a patient's electronic health record, or what we used to call the chart. All of you'll remember back in the day before computers, you'd go to your doctor's office and they'd literally have a paper chart, a file folder that they'd fold out in front of you.
I kind of liked that.
Yeah. Well, a lot of people do. Well, since the 90s and into the 2000s, we've transitioned all that to the electronic health record. So you have a file in a computer somewhere with not just a file folder, but thousands of pages of data about you. Much of it redundant, much of it that doesn't really count towards what you're seeing for the doctor that day, but for which your physician is responsible for not missing an important sentence or number from these thousands of pages. So I'm using AI now to summarize that for me in a patient's record. Take those thousands of pages, much of which is repetitive, down to a couple pages that can summarize the patient's psychiatric history for me. You're right. I have to then go back and match up the pertinent parts of that history to the actual part in the medical record, verify that it's real, verify that the AI is not hallucinating, and we'll talk about what that is in a bit. Or making it up, and to verify that it's true before I can then act on it in a reasonable fashion.
Well, tell us a little bit about an AI hallucination.
Yeah, so an AI hallucination is not like a hallucination a human might have, where we might see or hear something that isn't there because our brain is malfunctioning in some way. But an AI hallucination goes back to what these AI programs are, right? They're just statistical probability machines that they found this word, they found the word Adam associated with the word Eve so many times that they're going to say that's the word that's associated with Adam. But it's a probability. So let's say 76% of the time it's associated with Eve, and they say you want the word Eve. but the context you gave it, you really wanted the word, West for Adam West. It can make mistakes. So a hallucination is really just an AI mistake. Now, what's different about this AI than other computer programs is that sometimes the AI will then take that misattribution, that mistake, and then kind of spiral off it and go, oh, well, if that's what they wanted, then maybe this is what they wanted too. It can make the problem even more complex, more difficult to decipher, and can come up with, very strange stuff. For instance, I once asked AI, hey, based on what you know about me, create a resume for Josh Jones, just nothing else, just what's available. It made up a scientific paper that I had never written or published.
It just wanted to please you.
Olive, you nailed it. All these programs are designed to engage us and keep us putting in data so that these companies can mine our data. It wants you to stay engaged. It wants to please you, so you'll stay engaged with it.
Okay.
Yeah. I can see your mind is blown, and I hope other people's minds are blown about this too. Now, look, I'm not an anti-AI guy. I use it every day.
Right.
I just think we need to actually know what these things do.
We've been talking about AI, artificial intelligence, and its use in the medical field. And Dr. Jones, tell us a little bit about that. How is AI being used in the medical field?
Yeah, the number one way right now is, as we already talked about it, with these AI scribes. So where you talk to your doctor, and then AI, through usually a smartphone, is listening in. It creates a note, summarizes what you guys talked about, and that's pretty widespread. It's also being used, as I use it, to summarize these vast amounts of data that we collect in patients' charts to come up with some summaries. But it's also being used in other inventive areas to try to predict and take in vast amounts of data that we humans will sometimes misinterpret, to see if we can predict which patients in a hospital, for instance, are most susceptible to getting a hospital-acquired infection, like a catheter urinary tract infection, or you can sometimes get C. difficile infections, to see which patients are most susceptible there. Lots of drug companies are using AI to try to figure out new molecules without having to go through the very expensive process of developing the chemicals. They're trying to use AI modeling to figure out new molecules that might be used for pharmaceuticals. So there's lots of very inventive ways that people are trying to use AI to improve our health.
Can AI help with when you're going to see your general practitioner, and then you're being sent off to all of these different specialists, and all of these specialists are not talking to each other? Can AI work to kind of bring all of that, to bring the big picture together? Or is that something that, like, your general practitioner can say, okay, I'm sending you off to the heart doctor, and the heart doctor is sending you to the kidney doctor, and the kidney doctor is sending you to the psychiatrist? Can AI help bring all of that together so that one set of eyes is looking at this one patient, saying, what's the best way to go forward?
Yeah, there are a lot of people and a lot of companies thinking about how that might work. At the end of the day, an AI tool won't solve communication difficulties or lack of communication between two people or two healthcare professionals. What it might help solve is the interoperability problem. So, back in the late 90s, it was mandated that doctors and clinics and hospitals go to these electronic health records. What didn't happen was having all of them talk to each other real well. So for instance, if you go to Olympic Medical Center that is on one version of a computer program called Epic, but then you go out to Forks Hospital, well, they're also on Epic. Oh, no problem, except they're on different versions of Epic and they don't talk seamlessly to each other. AI may be able to help bridge those gaps if the companies that control this data agree to, or are forced to, let open some of the floodgates to allow this information to talk to each other. But that brings up another really important question, Olive, and that's the privacy of all this information, right? You want your healthcare record to be private, don't you?
Yes.
Yeah, absolutely. And so that's why it's very important to read those terms and conditions. I keep coming back to the boring stuff, don't I? But it's really important to understand what the terms and conditions are. And when healthcare organizations or hospitals partner with AI companies, they have to be really careful about how that company is going to use your protected healthcare information inside this AI model. So a lot of them, in fact, all of the responsible healthcare organizations are getting these firewalled, contained versions of AI that you can put protected healthcare information in. But those aren't accessible to you on your general computer. So I would be extraordinarily cautious for anybody who puts any of their own healthcare information voluntarily into these off-the-shelf products like ChatGPT, Claude, or anything like that. That's where you really need to know what they're going to use that information for. And just as a privacy advocate, I would say be very careful. And if you have any questions about it, don't put identifying information into these tools.
Let's talk about how we should use AI responsibly for our health.
Yeah, great. Let me reiterate some of the points that I've made earlier. If you're going to ask AI tools questions, medical questions about your health, take that information with a grain of salt. Understand that, if you just go to ChatGPT on the web, its programmer's goal is to get you to continue to engage with it. So it's going to tell you things you want to hear. It's going to make you feel good about talking to it so that you keep putting information into it. So that means you need to take the information you get back with a grain of salt and check it out. So just like anything you would read online or even read in a book or a magazine, now I'm dating myself, you should take that and talk about it with your trusted healthcare provider to see if that's information you should follow. I also very much caution people about putting their personal information into these AI models unless you are confident you know what the company who owns that model is going to do with your information. As we talked about, if something's free, you are the product. So be wary about that. And then ask questions. If your physician says, hey, I'm going to use this AI tool, if you have questions about it, ask about it. I have a lot of confidence that, my brothers and sisters in the medical world are trying to use these tools responsibly to make it easier for you to access your health. But it's okay to ask questions about, hey, why are you using this AI tool? Hey, are you using any AI tools? That's totally fine to do.
Well, let me ask you this. If someone comes to you and said, I am getting so much conflicting information, I have seen 3 specialists, and they come to you and say, now I'm asking for a 4th opinion. What do I do?
Well, that happens all the time.
Right.
I think after most responsible physicians, after like the 2nd opinion, if it's a 3rd opinion, they'll be asking questions. Hey, what are you looking to get? What are you hoping to gain out of another opinion? And that's what I do. I say, what are you seeking? Are you really seeking another opinion about your health? Or are you processing that you don't like what you've heard already?
Right, because AI tells me I'm just fine.
Yeah, yeah. AI tells you just fine. Great. Well, let's look at that. And ultimately, physicians. Doctor, by the way, Olive, comes from the old Greek term teacher. We are just guides on your healthcare journey. We can give you the information. We can tell you what we think you should do. You're the only one who can actually do it. It is very much the same thing as we go down this AI-led healthcare journey. I can really only guide you with what I've read, what I think, what I believe I know about AI, and it's up to you and everybody listening to decide what they're going to do with that information. You could take what I've told you and plug it into ChatGPT and say, hey, is what this guy's warning me about AI, is it true? And it's going to go, oh no, I'm wonderful. No, it will probably give you a nuanced version of that.
Right.
But I just liken me to the old carpenter who says, hey, you shouldn't be using the handle of that screwdriver to pound in a nail. I just want people to be understanding what these tools do and using them for the right job.
Okay. Well, now let's talk about your podcast.
Oh, thank you, Olive. One of my favorite topics. So my brother, Jeff Jones, and I, we have a podcast called Cinemental, Cinemental, which combines the cinema. My brother's a screenwriter and professor of screenwriting, and mental health. And each week, we look at a movie or TV show or a popular culture event, and we talk about the mental health implications of what's going on in that movie, TV show, or event. We talk about what they got right, what they got wrong, and what you should know. We recently did, an episode on the World Cup and on toxic fandom. Last week we recorded the Odyssey, which I know everyone's talking about.
Yeah.
And then we do a lot of throwbacks. Tonight we're actually going to record an episode on Fight Club. So talking about toxic masculinity and cults. So we do that every week. You can find us wherever you get your podcasts, Cinemental, Cinemental, or just Google or ChatGPT, Jones Brother Mental Health Podcast, and you will find us.
Great. We have a caller question. Someone called with this question. If medical records are given to AI to summarize, how is privacy protected, and how will AI use my medical information? This is a big privacy concern.
Mm-hmm. Yeah, it's a great question. And the answer is that a physician like myself should only be using an AI tool that their company has thoroughly vetted and has a business associate agreement with that company to keep your medical information firewalled and private so that it doesn't escape your company system and go into the ecosystem of the larger AI world. So again, what I'm preaching to my colleagues in the medical profession is make sure you understand before you put any information into AI, what's the protection. So I know I have vetted, and my company's chief medical information officer has vetted that nope, this stays here. It doesn't go anywhere else other than the hospital ecosystem, and the AI is on top of it, looking at the stuff, giving you information, and then being erased.
Okay, so in summary, be very careful with AI.
Yes.
And it wants to make you happy.
Yes.
Keep that in mind.
Yes, it does. Yeah, it wants your data.
Yeah.
It wants the information you give it. It wants to know how you're going to use it. I mean, that's and I'm talking, of course, about the free, readily available. If
right.
you just go on your computer and pull up Claude, that's what it wants. That's why it's available to you for free right now. Is it's collecting your data. It will say this in the user agreement that we all just click by or don't read. Yeah. Read those if you're going to use these. Again, I'm not anti-AI. I use it every day. But just know what the tool is, what its limitations are, and what your risks are in using it.
And you probably wouldn't make a very good boyfriend.
Well, it depends on what you're looking for, Olive. I would say no, but hey, what do I know?
Well, this has been fun. I'm so glad that you were able to join us today. We had you scheduled in May, and you were able to come today, and I hope you come back again because we always have a good time. Learn more about your podcast, and again, tell our listeners how they can find that, and we'll have you back.
Well, you can find our podcast on any of the podcast platforms, Apple, Spotify, etc. It's Cinemental, Cinemental, or you can Google us or ChatGPT us by asking for Jones Brothers Mental Health Podcast.
Jones Brothers Mental Health Podcast. I like that very much. So let me tell you about the SQM Free Clinic, because they are celebrating 25 years of service this year. That's 25 years of neighbors helping neighbors through free volunteer-driven healthcare. They have special events and celebrations planned throughout the year, so be sure to follow them on social media and check their website for updates. The website is squimfreeclinic.org, and if you don't have their newsletter, just visit the website and sign up, and then you can see this episode of Working on Wellness and see Dr. Jones. We got the video working finally, and so thanks again for coming.